Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, thanks for listening to the very first Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero, and I'm pretty excited to get this going. Something I've been thinking about for a while, and finally said, you know what, I've had some people ask about it, and I've been thinking about it, so I might as well go ahead and put it together and just go ahead and do it. So thank you so much for listening. Shout out to my hometown, Columbia, Louisiana, if anybody from there is listening to this. I am so thankful and grateful that you guys support me. I've had a wonderful support system in my community that's really allowed me to do the things I love to do and take care of people. So thank you so much. My wife and I own a private practice I've had for almost 9 years. We have 2 children, and I've been a practicing therapist for around 18 years. So I'm just pretty fortunate to have the life that I have and the career that I have. So let's get started. Today we're going to talk about cervicogenic headaches. What are cervicogenic headaches? What's the difference in them versus like a migraine headache or a tension headache or cluster headache? And then how do we treat them? And I'm also going to tell you a couple of quick things that you can do at home to try to see if you're having this going on. Maybe you can do a little test at home and see if this is what's happening, and then kind of go in the direction and try to get some help. So cervicogenic headaches, how are they different than migraine headaches? Migraine headaches typically will be on one side of the head, and the eye can have auditory and visual disturbances. So you can be also sensitive to light and sound, all those kind of things, and they can be very debilitating, as a lot of people unfortunately have experienced, as well as things like nausea and vomiting can occur. That's typically your migraine headaches, and a lot of times those usually respond fairly well to medications. That's something that's more medication based, as far as the treatment, or some people get Botox injections and things like that. Tension headaches typically start at the base of the neck back there. They are bilateral, so they kind of affect both sides of the neck and head, go over the entire head, and then go to the forehead area. That's your tension headache, and that's usually a compression of the greater occipital nerve as it comes through the trap muscle in the back of the neck. Cluster headaches typically affect males more than females, and a lot of times that's due to lack of oxygen. So somebody maybe has sleep apnea and may wake up with that pain, behind the eye on one side of the head, those kind of things. And the thing that's really different in these versus a cervicogenic headache is cervicogenic headaches have accompanied neck pain. And not just neck pain, but that also can go down into the shoulder, can go down into the arm, and cervicogenic headaches are unilateral, so they're just on one side of the neck and head. And you're going to have neck pain when you have a cervicogenic headache, although you don't have to have a headache when you have cervicogenic dysfunction. So you can have the issues with the neck, you may not have the headache, but if you're having the headache, then you usually are going to have that accompanied neck pain that's on one side. Just tender to touch on one side of the neck and in the back of the skull back there. And then it's going to present what's called a ram's horn presentation, where it just like goes over one side of the head and the face, in the shape of a ram's horn. So that's usually what you're going to see there with cervicogenic. And also you don't have like the visual disturbances usually, or the nausea and vomiting with a cervicogenic headache that you're going to have with, say, a migraine headache. That's really the difference, is you're having this dysfunction of the vertebrae, the upper cervical vertebrae. We have 7 cervical vertebrae, and so this is a dysfunction within the top 3, most especially C2 and C3. And if you don't know where C2 is, you can go to kind of that little bump knot spot behind your ear and just run your fingers over towards the center of your spine, and that other bumpy spot right in the center, that's the spinous process of C2. And so that's just, kind of where this is happening. And the upper cervical spine, the atlanto-occipital joint, where the base of the skull meets C1, and then into C2, it accounts for about 60% of rotation. So looking over your shoulder, either right or left, comes from that area, which is going to lead us into the little test that you can do at home to, try to determine if you have this going on. So what is the test that you can do at home? It's called the flexion rotation test. Well, there's actually 2 tests. I like them both. But the flexion rotation test is going to be the first one. You're just going to lie flat on your back on the floor or on the bed, and you're going to have somebody, grab let me back up. You're going to tuck your chin in. So you're going to take your chin and make kind of a double chin with it and tuck it in, You're going to hold that tuck position, and then somebody's going to take your head, bend it forwards, bring your head towards your upper chest, and then rotate your head to the right and then to the left or vice versa. Now we're looking for two things. We're looking for a decrease or a difference in range of motion, and we're also looking for a provocation or reproduction of your pain symptoms, whether it's the neck pain or the headache that occurs. So for instance, you should have 40 degrees of range of motion in the cervical spine. So where is that? You don't have a goniometer or something to measure this with. The chin should come out about over the middle of the collarbone or the clavicle, and that's about 40 degrees. And so if you turn the head to the left and you've got 40 degrees, and you turn the head to the right, you notice there's about a 20-degree deficit, then, and especially if it's accompanied by the neck pain or a headache, then you know that you're positive for cervicogenic dysfunction to the right. And so you can just do that at home. The other test that I like, and this one really surprises people, I think, like, how poorly they do on it, is the flexion or neck flexor endurance test, rather. And so what this is, you're going to lie flat on your back. You're going to tuck your chin in again, and you're going to bring your head about an inch off of the bed or floor, whatever surface that you're on, and you're going to hold it there. And so we're timing this. And so the timing starts the second that you get into the position, the timing starts. And there are kind of four things that we're looking for with this. And number one is, can you keep that chin in that tuck position? If you untuck your chin, the timer stops. The other is going to be if the back of your head touches the surface, or if you move it up and down, it's not stable, the timer stops. The next is going to be if you start to notice what's called the platysma, the muscles on the front side of the neck start to kind of, contribute, and you see those really kick in, then the timer stops. And then also the last is if you're just not able to hold that position, you start kind of spasming and trembling around, then the timer stops. And for men, you should have about 38 seconds, and for females, about 29 seconds, give or take. Should be how long you can hold that for. And if you don't, then you have a problem with your neck flexor endurance. So the neck flexors on the front side of the spine, and the extensors on the back side. So the extensors help you to look up at the ceiling, the flexors look down, towards the ground. And so that usually is accompanied, you'll have that neck flexor weakness or impaired endurance, and or neck extensor weakness that accompanies cervicogenic headaches, because basically those receptors in that cervical spine just become hyper irritated, or I hate to say confused because they're not thinking, but just getting misinformation in the joint space, and so you start to develop these cervicogenic symptoms. And so you're looking at treatment, the stuff that's been out there, of course, things like trigger point injections. They do nerve blocks. They use low dose antidepressants, muscle relaxers. All those types of things can be used. But of course, my favorite, and not just because I'm a therapist, but because of just what I've seen and experienced, and then what's based off of research, is the therapy treatment. But it has to be done really with a couple of different components. One of them is you have to do strengthening exercises, right? Because they're typically going to have this weak and poorly endurance neck flexors and neck extensor muscles. So you're going to do those exercises. The next thing you're going to do is neuromotor control exercises or activities. That's kind of organizing the movement with the muscles and the joints to kind of put things together so it's your brain's picking up information on appropriate movement. I use the motion guidance system with a laser and a target on the wall, which works really, really well. Something newer that we've been using at my clinic, which I love. And then the third thing is going to be joint mobilizations or manipulations. And so depending on your scope of practice, what your profession is, what your state is, whether you can do those or not do those, or whatever you call them, do you call them manipulations or mobilizations, et cetera, et cetera. So, but you can do gentle things with that. You don't have to just kind of whack and pop on somebody's neck. You can do gentle things and really make a big difference there. I also use the Mulligan technique with that. Now, I'm not a Mulligan certified educator or anything like that, but I have taken Mulligan courses and the Mulligan training, and it's something called mobilizational movement, which is the Mulligan technique, and I do a technique called a SNAG, which stands for sustained natural apophyseal glide, and that works really well. You'll get improvements with range of motion, especially with rotation. I mean, within like 30 seconds. It's really crazy. And then a lot of times you can abolish someone's headache that's going on right then. It just depends on how long it's been going on for, and how aggravated the nervous system is really as to how well that works. But and then you can do throw things in like a little massage, soft tissue work. If you want to put like electrical stim or ultrasound or all the feel good stuff and your laser and all that stuff's fine. But the three things based off of research that are the most effective are the strengthening exercises, the neuromotor control exercises, and the mobilizations and manipulations. I mean, I know some people get things like dry needling and all. They look a pin cushion and got all these needles in. But again, that's passive care, and that usually it's not going to last in most cases. Occasionally it will, and that's great for those people that those things do. But you're definitely going to have more of an active approach to really make it a lasting treatment that's going to get them some real relief. So. Anyway, so I hope that helps, guys. Like I said, that cervicogenic headaches that you can have, and if you guys have any questions related to this topic or any other topic, you can email me at chadgorthoot@gmail.com. You can email me there, and that email is used specifically for my social media platforms that I'm doing. So I definitely will check them, and if there's something I can help you with or something you want to discuss, just send me an email and we'll look at it and see what we can do. Again, I appreciate everyone so much for listening to this podcast. I hope that you'll listen again. Please rate me 5 stars wherever you listen to it. That really helps me out, and I very much appreciate it. And again, thanks so much for listening, guys. Have a great day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.